Alright, so about day 16, 17. It's been about 2 weeks since the big lock in my right knee. Been able to continue to train. I was able to get on the Peloton starting last week. So things are going well. No real pain in the knee with any ranges of motion. I have full range, almost, pretty much. And I'm kind of gauging it with these jiu-jitsu positions. So in my open guard, able to fully bend back a little, just a little something there when I do that. And then the other one, the main position that I'm kind of working with, is sitting back on my heels for this closed guard bottom, or top I guess it would be. So this is the one that I'm going to make the main standard of when I can go back to train, being able to sit comfortably on my heels again and being sure I can take the load in that position. One of the problems I was having before was it would kind of get semi-tweaked or aggravated whenever I would get caught in a hip bump sweep. So my knee would kind of twist as I'd fall over this way and then kind of buckle up onto my back. So that's one of the things I'm working on right now. Still continuing the exercises, so really working on quad and hamstring strength and control for this full range of motion. So a lot of stuff that we done in the first video, and really focusing in on the positional ability in my capsular cars. So being able to rotate that knee in a couple different degrees, and especially in these deeper knee flexion. So making sure I'm doing these pales rails, these progressive angular asymmetric loading, and these deeper flexions to load the knee. And along with sitting in that closed guard position, one of the things I'm going to be marking as I'm ready to go back to training is, can I load this without any pain pretty hard, looking at for that 70% mark. And especially at this really deep knee flexion. Strength is pretty good at about 90 and up below. It's these deeper knee flexion where you just can't put as much force into it. Also working on the other knee. This was the actual one I originally injured back 2 years ago, and I think wear and tear over time have caused both of them. This one has no problems with range of motion, so I'm just making sure to back up the training. Continuing to move as often as I can throughout the day, and at least one little bout of training almost every day. And then also continuing at least once with the acupuncture, the moxibustion and the needle that I showed in the last video. And this week I'm going to start adding an extra day, maybe on the off days, of some electroacupuncture, which has been shown to cause some of the same stimulation, maybe from a different marker, and I'll try to look up some research for that too. So in this video you'll kind of see that I'll be doing today here. So electroacupuncture deep into the needle, or into the capsule of the knee, trying to get some stimulation of some of the structure that's in there, hopefully bring some blood flow into what I think is meniscus. Still waiting for my appointment to see if I can get a diagnostic MRI to see what exactly is going on. So keep posted, and every week I'll just continue to see how my knee is doing. Maybe in the next week or two I'll be able to go back into training, slowly, progressively, going back to full rolling again. All right.